Hello, everybody. Welcome to De-Stress Holistic Health Web Series 1. My name is Rohini Rajiv. I am the director and the founder of De-Stress Holistic Health. I'm a counseling psychologist by profession. And what I have been observing the last couple of weeks due to the COVID-19 issues and concerns across the world is that there is an increase in the anxiety levels that most of us are experiencing. While it may not really lead to a diagnosis or a disorder like generalized anxiety, the concerns are real, the problems are very genuine, and people are getting more and more anxious than they've been before. So in order to address that, we at De-Stress decided to start a web series where we provide help for specific issues that are creating anxiety among different kinds of populations. So today, what we are going to be talking about is the problems or the concerns that young parents have with their children, given the fact that all hospitals are not open, consultations are not possible at all times the way it used to be before, and not everyone is comfortable with an online consultation, especially when it comes to taking their babies or showing things that um, are concerning the health of their child. So today, our guest, our eminent speaker is Dr. Gurmeet Soni Bhalla, my friend of 16 years, an eminent pediatrician, very well known for her approachability, for her brilliance in diagnosis, and the fact that she's not just a doctor, she's so much more than that. She's an ultramarathoner, she is a speaker, she's a guest faculty, she is an allergist, uh, a mom, a dog lover, and so many other things. So, welcome, Dr. Gurmeet Soni Bhalla, to the first web series of its kind. Thank you so much for your patience while I got this organized. I really appreciate you doing this for us. Could you tell us how long it's been since you started this journey, and what do you want our viewers to know?
Thank you, Rohini, for that warm introduction. And I am very pleased to be here, and I would love to do whatever I can, in whichever way I can, to allay the fears, anxiety, panic, which is going around. Coming back to the question on hand, I've been in practice, literally pediatric practice for about 23 years. Before that, so I would say over 25 years or more in medicine. I love children, so that's why I'm a pediatrician. Also, allergy is a passion. I like to solve the problems created by that. Yeah, and the rest of the things, I believe in preventive care. That's another big passion of mine. I do spread awareness about fitness. That's another big passion of mine, to keep people aware about how they should not only take care of physically, mentally as well. So yeah, that's what I do.
That's great. Dr. Gurmeet, what I also wanted to ask you is, over your 25 years of practice, how have you seen your patient population change, the parents' attitudes change towards childcare and medicine?
Yeah, I think a lot has changed, and then that's got to do more with how our the Internet of Things. I think the Internet of Things, or going onto the Internet, has made parents aware. Some in a good way, some in not so good way. Some help some of the issues that they actually go to the internet as a source helps them feel better, but some actually exaggerates and accentuates the worries. So, but I do have a very aware clientele of parents today than I had 10 years ago. Also, the parents now ask questions. That was not the norm earlier. Earlier, whatever was said was taken, nobody questioned you. But I have to, not that I didn't like explaining earlier, but a lot of my time goes in counseling the parents because they're very aware and then they ask questions. And if, I also encourage them to write their questions down when they come and meet me, because then it saves time for everyone. So that has changed quite a bit. Yes.
Do you also feel that now that we, the source of information is so much that when parents come to you, they come with, these are the symptoms my child has, and this is what, I came to know that it could be this, it could be that, and then they ask you to just verify the diagnosis and to make the diagnosis yourself?
Yeah, all the time. And like I said, sometimes that can be hard on us because a lot of them don't know the difference between viral, bacterial, fungal. So we have to start telling them the basics, and sometimes we don't have the time to do that. Sometimes they would find a swelling somewhere in the neck, and then they would have read it, and it will go from, and it could be as benign as an inflammation or an infection, but they would read about tuberculosis, they can read about cancer, they read about, autoimmune disorders. So to be able to comprehend is very difficult. So when they come up, there are a whole bunch of questions there. I feel that it's good to know, it's good to be knowledgeable, but once they come to a physician, a clinician, it's very important to have that trust factor. Yeah, that's very important. And I feel that somewhere it's not there so much. There is always a question mark. So that has changed over a period of time. That's why you will see that not many patients stick on to just one physician or one clinician. There is, it could be convenience too, but it's just that it's all right. They just want immediate resolution, and then they move on. Because I think somewhere down the line, a little trust has gone down there. I don't know for what reason, maybe too much knowledge.
Yeah, you get to read about the medication that's prescribed, so you come with a lot of preconceived notions, and I think a lot of times you question rather than accept what's being told to you.
Allopathy is very clear, right? It's all written. You can read and then you can comprehend. We don't do any other. The body, how it.
I'm sorry, I lost you there. I didn't hear the last bit of what you said.
Yeah, so I was saying in white.
Okay.
Fair enough. You should know what. And like it between the patient and the doctor.
Yeah. I think. Hello. Are you there, Gurmeet? I think I lost you. Hello. Are you there? Yeah. Yeah, I think so there should be some difference between an actual physician and someone from Google. Google doctor.
To Google.
Isn't it? So let's get on to the questions. There's a set of compiled questions I have, the various kinds of things that people usually reach out for, both family, friends, existing clients and patients, or their family, where a lot of these questions have come up. So I've just made a list of them. So I will ask you those questions one at a time. Yes, you can take it from there. So the first question here is, of course, I'm going to be reading the question as this is in first term. So my baby is of low birth weight. How often should I nurse him, and for how many months?
Hope there's a clarity below. You can't.
No, I can't. There's some problem, disturbance in the line. Are you experiencing any disturbance in the line?
It's perfect.
Really? Really? I'm not able to hear you at all. I mean, the screen is hanging. So, okay, one second.